Hey, it's Rebecca Smith from the KBIA newsroom in Columbia, and it's time for Missouri Health Talks, a project where we listen in on Missourians' conversations about access to health care. This week we hear from Dr. Brittney Marshall. She's been working in rural healthcare since her clinical days, now as the resident physician at Family Medicine in Fayette, Missouri. She spoke about why she chooses to work in and loves rural medicine. Here's Dr. Marshall.
So I really like my current clinic in Fayette. I like that it is rural and I get the rural healthcare experience and that feel of being in that small, tight-knit community. But it's also nice to still be working as a part of the greater Mizzou system where I know that I have access to specialists. So I think regardless of what field of medicine you're in, it's important to be able to know how to use your resources. And I think that's especially true in primary care because we're kind of jack of all trades. We see everything, we treat everything. I definitely think that getting to work in more than one environment, it really helps you grow because everyone does things slightly different. You also learn from patients too. And, even though both, Sedalia and Fayette are very rural populations and there's a lot of similarities there, there's still a lot of differences in, the major industries and the major employers that are in the area. That affects a lot of how people receive their health care. The immigration populations are very different. I really don't see a lot of non-English speaking patients in Fayette, but I saw them all the time in Sedalia. There's a very large Hispanic population, lots of Ukrainian population. So we were frequently using translators in our clinics there because a lot of patients didn't speak English. You come across people who don't necessarily trust doctors. And so once you, as their primary care provider, have earned their trust, they're like, why would I go all the way to Columbia? Why can't you just take care of it, doc? You're a doctor. Very humbling and very nice whenever patients trust me to that level. Sometimes it's like, well, I guess I get to be a pulmonologist today or a cardiologist. And I think that makes me a better doctor too. There are some stigmas that maybe people in rural areas are not as educated, not as health literate. There's always the stereotype of the farmer who never goes to the doctor and, has been having crushing chest pain for a week. Like, oh, it's fine. I got to finish the fence. I think that's not always the full picture. They're not always choosing to not come to the doctor just because they don't care about their health. Sometimes it's they've had a really bad experience and now they don't trust the healthcare system, or they don't have the time because they're a farmer and they're really busy or they can't afford it. Sometimes taking the approach of taking longer and really trying to spend time with my patients, it can wear on your mental health a little bit just because I can't shut down. I have to be emotionally invested, but not let it affect you too much. And so sometimes drawing that boundary can be a little bit difficult, but overall it fills my cup more whenever I am taking that time to be genuine and take time with my patients. I could talk all day about how much I love rural medicine, despite the challenges.
That was Dr. Brittney Marshall in Fayette, speaking about why she enjoys the challenges of practicing medicine in rural Missouri. That's it for this week's Missouri Health Talks, which was reported and produced by Sarah Kiefer. Tune in next week for more conversations from throughout the state about health and access. I'm Rebecca Smith. Thanks for listening.